And guess what? Nobody of us came with a manual. So there is no service manual for any one of us. So imagine, when we talk about things in medicine about, hey, this will work, it means that it would work for a majority of people. And nobody can say how things will work in one particular individual unless you try it. And that would actually is the center point why some people behave differently to different medicines. Some people smoke and die at 110 years of age, and some people smoke and die at 40 years. So think about it in these terms. And guess what? We do not come with a safety recall, right? And this is unfortunately, if you think about it, we take actually better care of the car which we own, which we can go to the dealer and say, hey, it's a hoopty. You know what a hoopty is? It's a car you drive and things fall apart. So you can take that car and to the dealer and say that, hey, it's a hoopty, get me a new one. You'll get a new one. But get what about this car? This is all we have. There is no safety recall, and you cannot tell your parents that, hey, you got me a lemon, get me a new one. Right? None of us get to choose this car. The car chose us. So people who understand Harry Potter, the wand chooses the wizard, or the other way around, right? So that is all. So think about it in this way, and this would actually help us guide through the myriad things that we discuss about in cardiology. Now, if you look at this poster, one thing you will find in most of the cardiology depictions or animations or posters or infographics is that you'll see a man. Most of the time, like 90% of the time, the graphic is going to be a man. But guess what? We'll talk about this thing. So, what is the leading cause of women in US, which killed close to 300,000 more women in 2013? Any guesses? Yeah. That is actually 1 in every 4 deaths in women. Believe it or not, this is heart disease we are talking about. Still, people still say, and people still think that heart disease is actually a man's disease. I don't think so. The data actually shows that there is same number of men and women die each year of the heart disease. 54% of the women only recognize that heart disease is the #1 killer for women in US. That's just half of the people. And this has changed because of our lifestyle change, things we eat, things we do. It's not like back in the 1800s when males are the one who went around and got the food and everything, and everybody else was at home. It's not the change. It's not the same anymore, and that has actually been shown in various studies that we have done about heart disease in women, and that's a stark reality. It is the leading cause of death in women. So if you think about African American and white women, heart disease is the leading cause of death, more than cancer.